Hi everyone, my name is Alicia Gillett and I'm a therapist with Natural Choice Medical Clinic. I've been a therapist with the clinic for approximately a year, and I've also been working in the field of social work and therapy for over 8 years. I've worked with youth all the way up to older adults and often addressing a range of different issues such as anxiety or depression. I wanted to take an opportunity today to thank you so much for having an interest in completing my quiz on children who experience anxiety, and also for maybe popping over to the website to look at the 3 blogs that I posted, which talk about what anxiety is, the common causes in children, as well as tips and tricks for day-to-day parenting, and then some strategies that you could work on teaching your child to help them manage their anxiety. I wanted to share with you today a little bit about what you would expect if you came in to talk to me about your child who is experiencing anxiety. Usually I start with working with parents directly. It might be anywhere from 1 to 3 sessions. As long as I can have at least 1 parent, that's great. If I can have 2, that's even better. Of course, there's single families as well, so I'm just happy to have whoever can come in who basically spends the majority of their time with the child in question. So in those sessions, we would be talking about if anxiety really is what your child is experiencing, or if there's something else that they've been struggling with that would fit their needs more. Once we understand that it is anxiety, then we're going to talk about what some of the causes might be, as well as what might be going well at home in the home environment, how you might have tried to address anxiety already, and then some things that you might be able to shift and change in the home environment to create a little bit more consistency and predictability, which can then help your child to cope and manage better overall. This also gives us an opportunity as adults to talk about any of the anxiety you might have that comes up when your child is experiencing some worry and seeming anxious themselves. So it can give you an opportunity to really talk through that and have some strategies to better manage and be there for your child when they need you. Once we've done those sessions, we can then work on bringing your child in. Usually the sessions with the child would require a parent to accompany them. This way you guys are working as a team together. However, if your child is a teenager and they're wanting to come on their own, that's awesome as well. Usually those first few sessions are to get to know your child, to learn who they are away from the problem of anxiety, their interests, the things that they do outside of school, that sort of thing. And once we built a rapport and it seems like they are feeling comfortable with me, then we would launch into talking about anxiety and what it is, the most common elements that come along with anxiety and the ways that it affects our thoughts, our feelings, our actions, and our bodily sensations. We would talk about how other kids around their age might experience anxiety and how it impacts them, and then what ways they might be similar to these kids and in what ways they might be a little bit different. And then we would hopefully then move towards talking about what's a nice individualized plan that we can come up with together to help them with their particular anxiety. So oftentimes this would be looking at developing some relaxation strategies. We would be looking at shifting some of the unhelpful thoughts that can come with anxiety. We would look at some mindfulness type strategies that are extremely helpful for managing anxiety in both kids and adults. And then the hope is that kids can go away and with the help of their parents, they can try out the strategies that we've talked about, and then they can come back and report how it went. We then might tweak some of the ideas, come up with new ideas, and see how it goes from there. I think a lot of families really like the idea that once they've made some progress, they can still always pop back for sessions whenever they need it. Sometimes it's just a quick check-in or to address a new little issue that's popped up, and it might just be a couple of sessions. So I hope that that helps to clarify a little bit more about what you can expect if you come in to talk with me about your child's anxiety. And if you have any further questions, of course, feel free to come in and meet with me. I offer a 30-minute free consultation, so that's a really nice way to see if it feels like a good fit for you and for your child, and to get some further questions answered. So I hope I get the opportunity to work with you in the future, and if not, all the best of luck to you. Take care.